Hi, my name is Brandon Proctor, and I am a social work student interning with Envision New Mexico.
Hello, I'm Wendy Linnebrink Allison, and I am also a social work student interning with the Leadership Education Neurodevelopment LEND program at the Center for Development and Disability at UNM.
And we are here with Envision New Mexico, and we're going to be sharing with you a video on behalf of Children's Medical Services to show you a little bit about how to incorporate Teach Back into the work that you do with your clients. And also, we will be sharing with you how to use the CHUMS, which is the Client Health Updated Medical Summaries tool. And we will be going over how you can use this as a communication pathway tool with your clients and how your clients can use that to communicate about their health information with their providers and with you, the social workers. And so first we're going to be starting with a video on what is Teach Back to give you a little overview, and we'll have a little chat afterwards about how we can incorporate that into this tool and the work that you do with your clients.
What in the world is Teach Back?
Teach Back is a way to confirm what your patient understands of what you've explained. It's a great tool that will not only help reduce our readmissions and improve our patient's experience, it improves our patient's comprehension.
I just don't understand. I don't have time to do Teach Back, and furthermore, what would I get out of it? Plus, I feel like I would be quizzing my patients and putting them on the spot.
I know. I felt that way too when I first started hearing about Teach Back, but I started to find phrases that worked for me, and now it feels authentic. I could actually see it help my patients and found that it helps to reduce the calls I receive after I've left the room.
Hey, you two, what are you talking about?
We just had this meeting about Teach Back.
Teach Back? What's that?
Teach Back is really a best practice that enables us as providers to learn from the patient what they understood by asking them to repeat back what they heard us say.
Oh, sure. I do that with my patients. As a nurse, I think it's my job to make sure I explain things well, so I'll say, I know we covered a lot of information. Can you tell me what you heard? Or I'll ask them a question like, when you get home, how many times a day are you going to take your medication? And just make up questions to be sure they understand. If they go home and don't understand how or when to take their medications, they could end up back in the hospital, and who wants that?
So do you just use Teach Back at discharge?
It's very useful during discharge, but I also use Teach Back when I'm doing any kind of education, or for sure when I'm sharing a new diagnosis. I've also used it when I see patients in the clinic too. It helps to make sure they know what the plan and the next steps are from the visit.
Yeah, I use it during their visit after I have reviewed the plan of care and what's coming next.
That's interesting.
Morning, Kevin. Have you thought any more about that Teach Back we were talking about?
No, but even if I wanted to incorporate this, I feel funny. It feels forced.
Let's try. Come with me to Mrs. Smith's room. I'm going in to discuss her discharge instructions, and you can see how I try to incorporate Teach Back. Knock, knock. Hi, Mrs. Smith. It's Dr. Gray again. I have Dr. Campbell with me as well. Would it be okay if he joined us today?
Yes, that would be all right with me.
Great, thank you. Well, Mrs. Smith, you're doing much better now, so we're ready to send you home. But it's really important that you make an appointment to see your primary care doctor, Dr. Johnson, within the next 5 days. If your symptoms get worse between now and then, we want you to come back in right away so we can check you out. It's also really important that you take your medication as prescribed. 2 pills, 3 times a day with food. Mrs. Smith, I know we've covered a lot, and I want to be sure I explained everything to you clearly. Can you tell me what you're going to do when you get home? When will you go to see Dr. Johnson?
I'm going to contact my doctor if I'm not feeling better in the next 5 days.
I'm sorry, I must not have explained it all very clearly. What I actually want you to do is to call Dr. Johnson, your primary doctor, and make an appointment to see him, regardless of how you're feeling, within the next 5 days.
Oh, I see. You want me to call my doctor even if I'm not feeling bad. I should still plan to follow up with Dr. Johnson in the next 5 days.
Yeah, that's right. You've got it. Now let's see. What questions do you have for me?
I guess that made a difference. She actually didn't understand.
Yeah, sometimes it's the small details that can make a big difference in how the patient does after they've left the hospital. It's always best when we can clarify those details in person before they go home. A few moments of teach back in the moment can help ensure patients receive the right follow-up and can save time in the long run. What do you think about teach back now?
I think I want to give it a try. I'd hate for my patients to be missing key details in their care. I guess I don't really know what my patients are taking away from my explanations and instructions, and I won't find out unless I ask them.
So we really hope you enjoyed watching that video. Teachback is a model that can help people understand the healthcare needs that they need to support themselves beyond the doctor's appointment. That video gives you an understanding of what it's like as a provider to incorporate Teachback into your everyday practices that you have with clients. What Brandon and I have been working on for a while now is incorporating a way to incorporate Teachback into the hands of the client, so as that the client is more proactive in talking about understanding what they hear from the provider rather than having it fall completely on the provider's hands. We would like it to be a cohesive relationship between the client and the provider, and so this CHUMS tool is a way that can help with that.
Yeah, and so we really want to, this CHUMS is going to help inform that. And you can see how, Teachback can be a little difficult to implement in your practice. And so we want this tool to be a communication pathway tool to help facilitate the process, because we try to keep all of our healthcare information in our heads. And so this is just something to make it a little easier to facilitate with your clients how to keep charge of their information, so that way they make the most out of their healthcare visits, either with their provider, with you, the social workers, or with their other community providers, to really make the most of it and make sure they have it in their hands and they're able to communicate what their needs are.
We're thinking that by using the CHUMS tool, it's not just a introduce it, one and done type thing, but we want to encourage both the CMS social worker and the client to think about how to use this for every single health appointment that they're going to, not just their appointments with you, but how to incorporate using this in every single appointment: dental, doctor, specialty, emergent, urgent, whatever's going on with a client. This tool can really help people to understand, remembering previous history about what's going on, and ask you key important questions that facilitate encouraging, remembering what you should be doing, and thinking about how to better support your needs for ongoing health care. So next we're going to watch a video that shows what an interaction would look like.
Hi, I'm Brandon. I'll be your CMS social worker.
I'm Wendy.
Hi, Wendy. And this must be Kevin.
This is Kevin. I had to bring him with me today. I couldn't get a babysitter.
Okay. Hi, Kevin. Today we're going to be going over how to best prepare you and Kevin for your healthcare visits that you'll be having. As we know that transitioning to different specialty care providers and getting new information, and it can be pretty complicated and stressful.
Yes.
And so we just received this tool to help us navigate that process together. And it's a tool that you can help take with you to help inform you about the care that you and Kevin will be needing to see your providers and your other community providers, as well as me, at your healthcare visits. It's called the CHUMS.
What's CHUMS?
CHUMS stands for Client Health Updated Medical Summaries. So that's why we call it CHUMS. So it's a pretty cool name. And what this will do is there's a series of cards in here, and this is a billfold. And so we'll go over some of these cards, and depending on what you need and or what Kevin needs, we can go over what will go in here. And so I'm thinking you can use a pencil for this, and you can erase and fill out as you need, or we can give you more cards if you lose a card. So this is just something, as we know, it's hard to keep all this information in our head. So this is just something that we can help, we can write it down, and that way we have it, and then we can have a discussion about it. So this tool, I guess, is mostly for really engaging and taking charge of that information. That way when you're going into your visits at the outreach clinics or at any visits at the hospital or anything that Kevin may need between providers, you'll have that information.
What kind of information should I be putting in there?
So let's take a look at some of the cards that we have. So the first card here, the intention is that, so we're going to fold them so that we have your personal health information on the inside, and then we have notes on the back if there's any additional notes. So this first card just basically has your personal information and then parent caregiver information. And so here is where you would write information about Kevin, important information that we would need to know, or that a provider would need to know, and then your information as the primary caregiver.
And so I can put my husband or my grandma's information too, because my grandma helps me take care of Kevin.
We can do that on this card, or we can also put that on this card as well. So this next card is the emergency contacts. Okay. So what I'm thinking might be easiest is we put Kevin's information and then your information, and then we can put other important people that help with Kevin's care on this emergency contact card. So
what does it say right here?
Another portion of these cards, and so we have our notes part, there is a teach back component on these cards.
Teach back.
What teach back is, it's a way to really get the most out of your healthcare visits, and the idea is to have to give you the skills and to also give me the skills to teach back the information that we receive from the provider, which can be complicated. And so this card, so each card has a theme, and when you pull it out, there's a teach back questions that you can ask your provider. Because sometimes we forget to ask questions, or providers will tell us the information, and then they're very quick, and then we move forward without really understanding what we're being told.
I know. I get home and my grandma asks me, "What did they talk about? What are we supposed to do to help Kevin?" And I just they said so much, I don't remember.
Mm-hmm. And so this is where this will come in. And so a lot of the times, teach back, providers try to do it in the moment. And you would do it in the moment where, you would ask questions, try to really understand what's going on, because sometimes we may interpret it wrong. And so that's where, if you're concerned about a certain topic that your provider is talking about, pull out a card and say, hey, let's talk about the emergency care plan, or let's talk about some of the information about what we need to do in case of an emergency.
What are some of the other questions? So
let's take a look at some of the other cards here. So we have those two that we'll be looking at for sure. So this is what to ask a healthcare provider. And so this would be this looks like a general teach back card. So when in doubt, pull out this card, and this is where you can write notes. You can write notes here. And so some of the questions we have is, please say that again. Please repeat what you're saying, and please explain those words to me, because sometimes they'll use really big words.
They do use pretty complicated words. Healthcare is so out of my scope of what I understand, and I just think they're completely frustrated too often, and I want to do what's right for Kevin.
Mm-hmm. And that's why this would be a great tool. And so we're going to figure out, how we can use this to help us out, because we all could use some help and support. So, and some of the other prompts here are, repeat what you heard, and this is where you can write things down. The issue or the diagnosis or the issue that we have is this, and this is what you would like us to do. So what are the next steps, and why should we do this?
So I'm thinking, if I'm going to use these cards at, my primary care doctor and in the emergency room and at my dentist even maybe, then maybe I should bring a notebook with me so as that I can write those questions in a notebook, because different providers will tell me different things, and I can't possibly write everything on that.
Right. And some of these other cards, this could be used as a general card, and that's where we go into, what are our healthcare providers? And so these cards, we have our healthcare providers, and then we have a card for specialty care providers. So if you want to bring a notebook that can help you take additional notes beyond the notes on some of these cards, that's perfectly fine. And so some of the information that you would ask your healthcare provider or your specialty care provider. So you would have, a list of what providers do you see, and then this is, another card that you can even add on to it, like, what is the specialty that they have? Why do I see this provider? And
that'd be
how
helpful
often.
to have on the card itself. Yeah.
And then, if there's any information, sometimes when we go to the dentist or when we go to the hospital, what kind of medical issues, and you can easily just pull this out and say, well, actually, here's all my information. Here's the providers that I see, and here's why I see them. Here's some of the concerns that we have. And so some of the prompts on here, so that may help you, but you can also bring a notebook if you have additional notes that you need to take, absolutely, and just to discuss with your provider. Any way that you can help prepare for your visit, or even in the moment, just pull out the card and ask the questions. And so these ones have questions like, when should I make the next appointment? Do I need to have any tests done beforehand?
Yeah.
Just
I feel
some
like
good.
They talk about that a lot during the appointment, but then they've talked about so much during the appointment. By the end, I can't remember everything that they've said. So I like that these cards have this kind of questions, and that the cards offer me the availability to put down information about key points about Kevin, so that I can better help Kevin out.
Right. And so these are some great prompts that you can ask the provider and figure out what the next steps are, and keep track of it, because it's hard to keep track of. And so that's what we envision for these cards.